This is Medical News Minute. Today is July 1st, 2021. I'm Dr. Ernst von Schwarz. An update on COVID, in particular the Delta variant from India, has been the preeminent cause for new infections in Europe, but also now in 50 states in the United States, the variant has been detected. Especially in areas with low vaccination rates, there's a much higher incidence of new infections, in particular with the Delta variant. Of interest, the Pfizer vaccine seems to be effective against this variant. Get vaccinated if you're not already. A word on the Longhaul Syndrome after COVID-19. A study from one of the Max Planck Institutes in Germany recently detected that there is changes in the shape and the deformity of red and white blood cells caused by COVID infections over a long period of time, meaning the red blood cells are less formable, they're more stiff, and this could lead to problems going through the small capillaries, especially in the lung of those patients, and that can lead to the symptoms we see in the long haulers, in particular fatigue and shortness of breath. So obviously this is one of the reasons why people have those symptoms for several months after COVID infections. And there's another interesting news that even POTS, the postural orthostatic tachycardia syndrome, where people get very dizzy when they change positions because of a drop in blood pressure and high heart rate, might be correlated also to COVID-19 infections, at least in some of the cases. And lastly, some news on cardiovascular risk. Recently, a study showed that 42% increase of cardiovascular death, in particular from ischemic heart disease, and almost 20% increase in stroke has been shown in people who work more than 55 hours per week. So long working hours is definitely connected and associated with a higher cardiovascular risk. The recommendation here is, of course, set boundaries between work and leisure time. Make sure you exercise, get appropriate resting phases in between your working hours, and limit the total hours as possible. Thank you so much.